The SIRS criteria are often used to identify sepsis. The problem with them is they're really sensitive, meaning a lot of patients meet the criteria, and they're not specific to sepsis. Interestingly, a few years ago, there was a study published demonstrating when you add end tidal CO2. So here's how the study went. A patient met two of the four SIRS criteria. So this is done in pre-hospital and then into the emergency department. They met two of the four SIRS criteria, and then what they would do is add end tidal CO2. So if the end tidal CO2 was less than or equal to 25, with two SIRS criteria, they would activate a sepsis alert. And if you think about it, it kind of makes sense because if your end tidal is low, how are you breathing? Fast. You're blowing off your CO2. And what they found was when a patient met two SIRS criteria, had an end tidal of 25 or less, and they suspected an infection, they activate the sepsis alert. And what they found was it had a very, very high predictability in that these patients ended up being septic. So again, remember the respiratory rate is one of the most important criteria, and it's the most predictive criteria in helping to identify sepsis. So always think about that at the bedside. And, even if you got to spend 6 seconds, multiply by 10, counting that respiratory rate, that's going to be way more accurate than, let's be honest, guessing it, which I can tell you a lot of us do. So anyway, so just a little tip at the bedside to kind of help identify sepsis.